Type 1 diabetes can lower your life expectancy by around 10 years, so any natural intervention that can help with this condition may also help to extend your lifespan. Type 1 diabetics generally have low vitamin C levels, so by increasing the amount of vitamin C in the bloodstream, the amount of sorbitol may be lowered. Sorbitol is a harmful sugar when it accumulates, and its presence can lead to increased risk of diabetic complications such as retinopathy, neuropathy, and kidney damage. The best form of vitamin C is liposomal vitamin C. The next best is non-acidic pH buffered forms, with the worst being cheap acidic ascorbic acid. Vitamin D3 may improve blood sugar control in those with type 1 diabetes, especially in those with low vitamin D levels. Vitamin D is needed to regulate immune activity, and research has shown that it has an important role in preventing autoimmune diseases, including type 1 diabetes. You want to get a 25-hydroxy vitamin D blood test and then supplement with vitamin D3 accordingly. In type 1 diabetes, or late stage of type 2 diabetes, it's characterized by poor beta cell function. Berberine was able to increase insulin secretion by repairing destruction of exhausted islets, which may be related to its antioxidant and anti-lipid peroxidation properties. Berberine hydrochloride is the common form, and doses of 500 milligrams are taken 3 times per day. Not only do they improve insulin sensitivity, but there's compelling evidence that it may also extend lifespan. You can see my other videos, one on life extension and one on the anabolic triad, for more information about the benefits of berberine. Growing evidence suggests that chromium supplementation, particularly at high doses and in the form of chromium picolinate, may improve insulin sensitivity and glucose metabolism in patients with glucose intolerance and type 1, type 2, gestational and steroid-induced diabetes, and in some individuals without diabetes. In a placebo-controlled trial, people with type 1 diabetes were treated with biotin at doses of around 2 to 4 milligrams per day, depending on their body weight, and they had improvements in blood glucose regulation and blood lipid levels after 3 months. Case reports suggest that biotin may also reduce pain from diabetic nerve damage, known as neuropathy. Research has proven that a deficiency in vitamin B12 is more common among those with type 1 diabetes when compared to the general population. It's especially true for individuals with type 1 diabetes who are on metformin, as this limits the absorption of B12 from food. You can get a B12 blood test. However, now that food is fortified with folate, this can give a false B12 reading and you can miss a deficiency. If you can't get intravenous B12, then the next best form is oral sublingual methylcobalamin B12 powder. In one study, researchers in India found that adding 100 grams of defatted fenugreek seed powder to the daily diet of patients with insulin-dependent type 1 diabetes significantly reduced their fasting blood glucose levels, improved glucose tolerance, and also lowered total cholesterol, LDL, which is known as bad cholesterol. Misalignment of circadian rhythms has been evidenced in patients with type 1 diabetes, and there's a close relationship between alterations in the neuroendocrine sleep architecture, the circadian clock oscillations, glucose metabolism, autonomic function, and diurnal profiles of blood pressure and heart rate. You can see my other video on herbs for sleep for more information about some natural sleep remedies that may help here. While most of the research on alpha-lipoic acid in diabetes has focused on its effects on neuropathy, several clinical trials have now found that alpha-lipoic acid may increase insulin sensitivity and help reduce blood sugar and lipids, largely through improving measures of oxidative stress and inflammation. Typical doses are 600 milligrams taken 2 to 3 times per day. Compounds found in grapes might help to slow the progression of type 1 diabetes. This is according to a study conducted by researchers from the Agriculture Research Services and published in the journal Agriculture Research. The researchers fed 2 groups of mice with type 1 diabetes a similar diet, but they added freeze-dried grape powder to the food of one group. The grape powder made up approximately 1% of the mice's diet. The progression of type 1 diabetes stopped among the mice in the grape powder group, and mice in that group also lived longer than mice in the control group. According to the researchers, the amount of freeze-dried grape powder given to the mice would be equivalent to 6 human servings of the same powder, and eating large quantities of grapes would be unlikely to provide any benefit for diabetics due to their high sugar content. The researchers have not yet determined what compounds or mixture of compounds in the grape powder produce the health effects in the mice, or its mechanism of action. However, they speculate that the grape powder may prevent immune cells from entering the pancreas, where they are known to attack the beta cells that produce the body's insulin. When a person has type 1 diabetes, they're unable to produce insulin, which the body needs to manage blood sugar. But according to a study which was led by researchers from the University of Birmingham, individuals with this lifelong condition can delay its progression through regular exercise, especially during the first few months of diagnosis. If left untreated, type 1 diabetes can make your blood glucose levels skyrocket, and this condition can also increase the risk of severe complications like blindness and kidney disease. Volunteers who followed an active exercise regime after a type 1 diagnosis were able to extend their partial remission or their honeymoon period by 5 times, unlike those who didn't exercise. This makes sense, as it's known that if you have a light 20 to 30-minute walk after each meal, this activity helps to lower blood sugar and can lead to many benefits by helping to prevent a blood sugar spike.